Hello, my name is Nikk Cochran Selik, and I use he, him pronouns. Today, I'm going to be talking to you about some of the basics around a highly trending topic within the scope of LGBTQ healthcare, which is gender affirmation for transgender and gender diverse youth and teens. As a quick reminder, just so we're all on the same page, the word transgender describes those who experience their gender identity differently than their sex assigned at birth. We also use the term gender diverse as a broader category for those who do not experience their gender within the binary or as exclusively either male or female. As we've seen recently, the concept of gender affirmation for young folks has become a massive political target, as well as the center of much unwarranted controversy fueled by the intentional spread of misinformation. Having said that, I'd like to start by addressing perhaps one of the most common concerns around transgender youth and teens. Aren't they a little too young to know? I'd like to answer that question with this photo, which was taken on Halloween in 1997. On the right is my little sister at 6 years old, wearing the 1950s costume with the pink poodle skirt. And then we have me at 9 years old on the left, wearing the ninja costume with the dagger and the blacked out tooth. Growing up, this was par for the course, as every Halloween was just an opportunity for me to dress up in a boy's costume, while my sister just wanted to be the pretty princess each year. My point in showing you this photo is to demonstrate in a more visual capacity that transgender youth are not too young to know who they are. In fact, many transgender adults, myself included, have known that they were transgender or somehow different from a very young age, but we did not necessarily have the words or the knowledge or the ability to express that at the time. But on the other hand, it's equally important to acknowledge that many children do express what we would usually consider cross gender traits, behaviors, or tendencies at different points throughout their development. And this does not inherently mean that they are or that they will be transgender. So, how can you tell? Well, a simple guideline and a sort of mantra commonly used among parents of trans youth is if, in regards to their gender identity, they are insistent, persistent, and consistent, then they may be transgender. Insistent meaning unwavering, persistent, continuing firmly in spite of difficulty or opposition, and consistent, unchanging in nature over a period of time. And to be clear, this is by no means a definitive test, but rather something to observe over time in order to provide the proper guidance that is still gender affirming and honors who they really are. As with any young person, having parental support at home plays a large role in their social and psychological development. However, if they happen to be transgender, the factor of parental involvement tends to have a magnified influence, for better or for worse. Unfortunately, there are many transgender youth and teens out there who lack the support they need to thrive as themselves. Rejection comes in various forms, of course, but this does include extreme measures such as conversion therapy. Many organizations, including the American Psychological Association, the Substance Abuse and Mental Health Services Administration, as well as the American Academy of Child and Adolescent Psychiatry, have strongly asserted that attempting to prevent or change a young person's gender identity in any form is ineffective and can be extremely harmful. Some examples of the ways that the trauma of rejection can manifest include psychological problems such as depression, anxiety, substance abuse, and suicidal ideation or attempts. Some of these problems may become apparent immediately, while others may not come to the surface until later in adulthood. At the heart of this, any practice that pathologizes transgender identity or views it as a problem or an illness often has long lasting, damaging consequences. Realistically, it's not possible to entirely prevent all of the problems young folks may experience related to their gender identity in life. However, the good news is most of them can be proactively mitigated through providing support and allowing access to gender affirmation. The term gender affirmation broadly refers to the process of shifting away from the sex assigned at birth and towards the person's authentic gender identity. Regarding gender affirmation for youth and teens, this can be looked at as four pillars, if you will. Some of these things involve more permanent changes. Some other things are able to be adjusted over time. Starts with psychological gender affirmation, which means that they feel their gender identity is seen, validated, and respected by their parents, family, teachers, peers, etc. It means that they are not shamed or made to feel guilty for who they are. And it also means that they are not forced to constantly explain or justify their gender identity to others. Psychological gender affirmation is really the foundation of our next pillar, which is social gender affirmation. And this one refers to a couple of things. The first one is that they are able to express and present their gender identity, whether it be through things like clothing, hair, makeup, and so on, in ways that are consistent with how they experience themselves. The other part is that they are referred to by their correct or chosen name and pronouns. Sometimes the name or pronouns they may use can change later on, and that's okay. By not enforcing our own expectations of gender upon youth and teens, we're allowing them the freedom to explore who they really are as they develop in ways that are both healthy and affirming. The third pillar is legal gender affirmation, and this one revolves around name changes and correcting gender markers on legal documents. Some things to take into consideration are birth certificate, social security card, passport, and specifically for teens, driver's licenses and state IDs. It's important to note that some states do not allow gender marker changes on documents at all. Fortunately, though, the process has, for the most part, become easier and more accessible with less red tape involved in the past 5 years or so. Lastly, there is medical gender affirmation, which can include a few things. Puberty blockers, the first thing, as the name implies, is a treatment that pauses natal or endogenous puberty and prevents secondary sex characteristics from developing in puberty age adolescents. And despite the myths that continue to be perpetuated around the dangers of gender affirming treatment, puberty blockers are, in fact, safe to use. Both the Endocrine Society and WPATH support the use of puberty blockers for youth who want to delay or prevent these unwanted physical changes. And in general, the US Food and Drug Administration has also approved this treatment for youth who start puberty at too young of an age. Puberty blockers are also, in fact, reversible. This means that even if the youth were to change their mind about their gender, despite having met the rigorous criteria even before beginning this type of medical intervention, well, they can stop the treatment and endogenous puberty will resume. Also consider the other side of that. Endogenous puberty itself, reversible. It is physically permanent and often psychologically damaging for trans people to go through. Several recent studies have shown the many benefits to utilizing treatment to delay puberty, including improved mental health, improved peer interactions, and it may eliminate the need for future surgeries. Gender affirming hormone therapy is the second one, which utilizes testosterone or estrogen to change secondary sex characteristics to align the person's body with their gender identity. Ideally, this treatment is started at the appropriate age of puberty onset, corresponding with the person's gender identity. However, gender affirming hormone therapy can be started later in life as an adult. And lastly, gender confirmation surgery is a whole nother presentation that we do not have time for today. But what I can tell you, generally speaking, the purpose is also to align the person's body with their gender identity. This is a consideration for older teens and adults only. Gender confirmation surgeries are not being performed on children, despite what certain political affiliates may propound. There are so many different surgeries and procedures and techniques out there, and all of this is extremely dependent on the individual. In conclusion, having access to gender affirmation for youth and teens is, in most cases, quite literally life-saving. Despite the fact that the transgender community is a highly vulnerable population that continues to be politically attacked while subjected to widespread discrimination, time and time again, we have proven ourselves to be fearlessly authentic and extraordinarily resilient. Thank you.